You're losing your hair. Maybe your friends have mentioned it, or maybe it was at someone special in your life. And now that you can't ignore it anymore, you finally decided to do something about it. But be careful what you buy, because there are a ton of products out there that claim to be able to bring back your hair, but none of them are actually as proven as the original itself, Rogaine. Rogaine, also known as Minoxidil, is one of the most popular and easiest treatments to get a hold of for your hair loss. It's easy to buy over the counter in stores across the country, and every year millions of men hang their hopes of a full head of hair on this little bottle. But is Minoxidil really the answer to getting all of your hair back? Today we're going to dive deep into the history of Minoxidil, how it works, the side effects, and even what happens if you stop using Minoxidil. So make sure you watch to the end so that you know everything there is to know before trying it. Who knows? I might just save you some money and some time. Minoxidil got its start as a medication to treat high blood pressure in the early 1970s. While it worked for high blood pressure, doctors began noticing that their patients were complaining of more hair growth, not just on their scalp, but all over their body. This led to researchers to begin looking into Minoxidil as a possible treatment for male pattern baldness. After a lot of research, some of which was not by the books, Minoxidil was finally approved for use in male pattern baldness in 1986. That first approved concentration was the 2% form, and then that was soon followed up by the 5% concentration in 1993. So how does Minoxidil work? Well, Minoxidil is not an active medication. It actually has to be converted to the active form once it's applied to your scalp. When Minoxidil gets absorbed into your scalp, it gets activated by an enzyme called sulfatransferase. This enzyme is found in your hair follicles and is the main factor in determining how well Minoxidil will work for you. If you have high levels of sulfatransferase, then you have a better chance of Minoxidil actually making a difference in your thinning hair. This sulfatransferase enzyme converts Minoxidil to the active form called minoxidil sulfate. This active form of Minoxidil helps to dilate or widen the blood vessels in your scalp. Wider blood vessels improve the blood supply to the scalp, which in turn helps to keep your hair follicles in their growth phase for a longer period of time. More time in the growth phase means more hair on top of your head. So what are the different forms of Minoxidil? Well, Minoxidil comes in 3 different forms to treat hair loss. The most common form is the topical version, which you can buy over the counter without a prescription. There are 2 types of topical Minoxidil available, liquid and foam. There's also 2 different strengths available over the counter as well. 5%, which is typically reserved for men, and then there's the 2% version, which is marketed more towards the ladies. Why the weaker concentration? Well, that's to ease concerns about unwanted hair growth that women tend to dislike on the face and other places close to the treatment areas. The liquid version uses a dropper to allow you to apply it to the areas that you want to see more hair growth. The liquid version also has an ingredient called propylene glycol, which helps the medication absorb deeper into the skin. The problem with this ingredient is that it can cause scalp irritation in some people. The second version of topical Minoxidil is the foam version, and this one does not have propylene glycol in it and is actually less irritating to the scalp. It also tends to stay more localized once it's been applied, and it actually dries a little quicker too. While these 2 forms of Minoxidil are the easiest to get a hold of, there is a pill version that is actually easier to use. The pill form comes in a 2.5 milligram and a 5 milligram dose that we typically use for hair loss. If you're using the topical versions of Minoxidil, you'll need to apply it to the skin of your scalp. The only part of your hair that's actually alive is what's under the skin, so rubbing it through your hair is really not going to do anything at all. It actually has to be applied to the skin. Once the medication is applied, it can take about 4 to 6 hours until you get an effective dose absorbed into your system. So it's best applied to a dry scalp both morning and night. The recommended dose for the liquid form in men is 1 milliliter of the 5% strength applied twice daily to the scalp. The foam version is recommended to be used twice daily as well, but only a half capful of the 5% strength. For the ladies, it's recommended to use 1 milliliter of the 2% solution twice daily, or just a capful of the foam once a day. The pill version, though, is much easier to use. It's a once-a-day tablet that has the same effect as the topical versions, and according to some studies, could actually be a little more effective in stimulating your hair growth. But are there any side effects? Well, there are a few. The topical versions of Minoxidil can cause scalp irritation and redness where it's applied. This is more common in the liquid form of Minoxidil because it has that propylene glycol that we talked about earlier. But the foam version doesn't have this, so it's less irritating to the scalp. That's why I tend to recommend the foam version to my patients just starting out on topical Minoxidil. Other side effects can include things like extra hair growth in areas you may not really want extra hair. Other reported side effects can include things like headaches, dizziness when standing up too fast, blurred vision, swelling of the face, acne in the treatment areas, fast heartbeats, and even some low blood pressure. The most severe side effect can be fluid buildup around the heart, otherwise known as pericardial effusion. This has been recorded in multiple reports and is most common in people taking Minoxidil who already have kidney or heart failure. Now, there are rare reports, though, that this has happened to people without kidney or heart failure as well. These patients also tend to have a higher risk of developing swelling of the legs when taking minoxidil due to fluid retention. On the other hand, there's a chance that the pill version could cause you to have more body hair growth than you would actually want. Typically for the guys, this isn't a problem, but the ladies may want to take that into consideration when using the pill form. And if you do end up with excess hair growth while using the pill version, it goes away after a few weeks of stopping the medication. But here's the side effect that everyone freaks out about: increased hair shedding. About 2 to 4 weeks after starting minoxidil, some patients can experience an increase in hair shedding. For people that don't know, they tend to freak out and they think that minoxidil is actually making their hair loss worse. And a lot of those people will stop using minoxidil because of this. But in reality, this is a totally normal occurrence. The medication is actually causing your hair to switch from the resting phase of its growth cycle, known as telogen, to the active growth cycle called anagen. And to do that, the old hair has to fall out to make room for the new hair that's coming in. And while this can be alarming to some people, if you continue to use minoxidil, you'll start to see improvement in about 4 to 6 months after starting the medication. So then how long do I need to use minoxidil to see the results? So if you need to use minoxidil for 4 to 6 months just to start seeing results, then you need to use it for a minimum of about a year to see the maximal results. Why? Because your hair is in multiple stages of growth at any given point of the year. Some hair is in the resting phase for about 3 to 4 months out of the year, and then other hairs can be in their growth phase for up to about 2 years at a time. So since not all of your hair is in the growth phase all at the same time, it can take about 12 to 14 months to see the full effect. So hang in there and be patient with it. It'll come. But then you might be wondering, how long do I have to use it after the 1-year mark? Well, the simple answer is that you'll need to use it for as long as you like having hair. The reason being is that there is no cure for hair loss, only slowing it down. And remember, the baseline definition of success with minoxidil is that we keep your hair looking the same as it looks now. That means today. So meaning that some of you may not get a ton of improvement with minoxidil. Some of you may just end up maintaining where you are now. And that may make you feel like minoxidil isn't working for you. And that could be true. Only about 2 out of 3 men will see some improvement in their hair using topical minoxidil. On the other hand, using the pill version has reports of about 80% of people seeing improvement in their hair density. Minoxidil tends to produce the best results in people who are in their early stages of hair loss. If you have just a little bit of thinning, then it takes much less improvement to see a big difference in your hair. Those of you with advanced hair loss are likely to see less improvement, but it's still important to try and use it if you want to get improvement in those thinning areas. And those of you that are applying minoxidil to bare skin on the scalp are just simply really wasting your time. Once your hair thins down to the bare skin, there is no amount of medication that will bring that hair back to those areas. You'll need a hair transplant for that. But then there's a subset of people out there that won't see a lot of improvement with topical minoxidil because their hair follicle is actually lacking that important substance to make minoxidil work. Remember earlier when we talked about sulfatransferase? That's the enzyme that's responsible for activating minoxidil once it gets to your hair follicle. And if you don't have high levels of sulfatransferase, then you won't get great results with topical minoxidil. How would you know if you have high levels or low levels of sulfatransferase? Well, there are companies out there that will test your hair strands for this enzyme. I have no idea how accurate they are, but there are companies out there that claim they can do this. The better way around this, though, is to use the pill version of minoxidil. That's because about 95% of the medication gets absorbed when taking it by mouth, versus the 1.4% that gets absorbed when applying it to your skin. The pill version also gets activated in the liver where there are much higher levels of sulfatransferase. This makes it much more likely to have a beneficial effect on your thinning hair. The downside is that you need to see a doctor to get on the pill version since you will need a prescription for it. But let's say you miss a dose of minoxidil or maybe even decide to stop using it altogether. If you miss a dose, that's no big deal. Just remember to apply the next dose and you'll be back on track. You won't lose all the hair you've gained back overnight if you miss a dose. But what happens if you stop using it altogether? You'll be fine for a few weeks, but as the effects of the medication wear off, you'll eventually go back to your baseline, which was your natural progression of hair loss. So your shedding simply starts to resume again over the next 3 to 6 months. Eventually, all the gains you had from using minoxidil will be gone, especially if you aren't using any other medications to help you keep your hair like finasteride. But let's say you don't want to use any medications to help you keep your hair. You want to be all natural and restore your hair using your own body's natural growth factors that can be found in your blood. Well, in that case, you should watch this video right here where we talk all about platelet-rich plasma, including what it can and cannot do for your hair. I'm Dr. Paul Pierce and hope you learned something today. I'll see you in the next video.